Hello, everyone, and thank you for joining our ICTR Enrichment Seminar Series today. I am Wanda Fink, the ICTR Director of Operations and your host for this session. We are so pleased to introduce our guest speakers today, Dr. Julie Doherty and Jan Martinez. Dr. Doherty is the Assistant Vice President of Research Compliance for the UMB campus, and Jan Martinez is the IRB Manager and also from the Office of Accountability and Compliance and Human Research Protections Office here on our campus. With the increase in community-engaged research involving patients and community members as advisors versus human subjects, the line between human subjects research and non-human subjects research is sometimes blurred. Moreover, many community-engaged research studies have both a non-human subjects research phase, such as working with an advisory board, and subsequent investigational phase during which a full IRB protocol for human subjects research is needed. This session is a great opportunity for researchers to learn about the nuances of when community-engaged research, especially when including the community as advisors. Before we begin, please note the QR survey code on your screen, and please take a moment and let us know your future topics that you would like the ICTR to bring to you. We will reserve the last 10 or 15 minutes or so for questions, so feel free to enter your questions in the chat or QA feature. And with that, thank you. And now I am very pleased to turn your attention to Dr. Doherty and Ms. Martinez. I'm going to stop sharing. And so.
Thank you, Wanda. And thank you to the ICTR and to Dr. Davis for having us today to talk about understanding community members' roles in community-based participatory research. Both Jan and I will be speaking and are happy to take any questions you will have during the course of the presentation and through the chat, as Wanda said. Our working title, Walking the Fine Line Between Human Subjects Research and Non-Human Subjects Research when Engaging the Research Community. And we'll talk today about those nuances. What I wanted to start with, though, is I wanted us to have a framework and to set the tone for where we are and what we're trying to accomplish. In terms of community-based participatory research and looking to the past and how research has been conducted, this is directly from one of the IRB management books, and I thought it was very important to kind of frame our talk today. So in the past, researchers have conducted research in and on certain communities and patients without ever truly involving them. There are many lamentable stories of researchers dropping in, conducting their research, and then leaving without ever sharing the results with the community or patient group. This behavior has resulted in certain communities and populations feeling used, underrepresented, and distrustful of researchers. Such feelings exacerbate barriers to leveraging research to improve health disparities faced by these communities and patient groups. Now, I know I just read the slide word for word, but I thought the sentiments and what is being expressed is extremely important within community-based research. So in an attempt to avoid repeating mistakes of the past and recognition that ethical research should be done with communities and not to communities, unique research approaches have been developed, such as community-based participatory research, community-engaged research, etc. All of these approaches can be broadly understood as efforts to better engage populations that will be affected by the research. In order, and here's what's extremely important, to increase transparency, better protect subjects and communities, increase the relevance and benefits of the research, and more generally respect those communities. So I want us to keep these two quotes in mind as we move forward through the presentation and as you move forward in using community-based participatory research as a research design. We're going to cover today the following three topics: understanding what is human subjects research, and what is non-human subjects research, distinguishing the community's roles and the differences in human research, and identifying when a collaborating community member is engaged in a human research activity. So first, I want to start with some definitions and roles so that we have a basis of what we're talking about. So what is human subjects research? This is the definition directly out of the federal regulations, and this is what the IRB uses to determine whether an activity is research. So it's defined as a systematic investigation, including research development, testing, and evaluation designed to develop or contribute to generalizable knowledge. And then the definition of research involving human subjects. This definition was updated with the common rule revisions in 2019. So the definition has been expanded. So research involving human subjects is when an investigator, whether a professional or a student, conducting research on a living individual, obtains information or biospecimens through intervention or interaction with the individual, and uses, studies, or analyzes the information or biospecimens, or the investigator obtains, uses, studies, analyzes, or generates identifiable private information or identifiable biospecimens. So the definition expanded to include specifics about information and biospecimens. So this is important as we move forward in this area. So when we look at community-based participatory research, what are we looking at, and how should we, parse out what we're doing and how it's being done within the community? So community-based participatory research is a collaborative approach. It involves all stakeholders throughout the research process. It's not just the investigator, but it's the community, advisory boards, and others. Again, collaborative approach. It's an inclusive process. So we start with involvement of the community at the beginning, where the investigators are establishing the research question, developing data collection tools, analyzing data, and then disseminating the findings to the research community. So it involves interactions with the research community right up front to say what's important to the research community, what types of issues are important to the community, and where does the community need or want to see improvement in health disparities or other areas. It's community focused. So it aims to address the practical concerns of people in a community. So what the investigator may see as being important to the community may not actually be the number one priority of that community. So that's where that dialogue and conversation is extremely important, to say what's important, what are the needs of the community, and how can we collaborate together to bring about change and improvement. And it's role transforming. It changes the traditional roles of researchers and those being researched. It's not just, in the past, it's always been the investigator is driving the bus, is driving the research, and the community is involved at some point. With community-based participatory research, community is involved from the very beginning all the way through to the end when they receive the study findings. So community roles in research. Jan?
Yep. Hello, everybody, and thank you for being here today, and thank you for inviting us to this presentation. I want to talk some about community roles, and it is important to understand the differences, because one of the questions, and this is why we included the definition of research and human subject research. because I know we get a lot of questions, especially like I said, walking the line between non-human subject research and human subject research. And I think it's important to understand it is based on the roles. When we are working with individuals and we're trying to define whether what we are doing with them is considered human subject research or is considered just a collaboration with a community representative. So it is very important to understand the different levels. So the way that I listed here is more to understand in terms of the relevance of what we're discussing here today. We're not trying to say that human subjects are less than, the collaborators or the non-collaborator. It's just that is the level and the order that we would like to discuss. And the first one is the obvious one, those individuals that are non-collaborating individuals. And that would be the next slide. And basically, these individuals, the level of involvement in these activities are minimal. It's just maybe a by chance experience or a situation. It's not like they are actively engaging as part of the research plans or the research activity. They have living researchers, and they basically have no contribution specifically toward that research protocol. Like whatever they're doing is not like critical in order to answer whatever the questions the researchers have about the purpose of their study. So then, of course, we have some examples that we have of what non-collaborating individuals are, and that will be the next slides.
I'm not able to advance the slide for some reason. It's not advancing.
Interesting. Well, you're going to have to listen to my voice until we can fix that. So one of the examples that we have with individuals that are not collaborating are individuals basically that don't know that something is happening. They're not aware that there is any research efforts taking place in their community, or individuals that were invited to collaborate or to participate in a study and they simply declined, or even people that are providing certain service and all they're doing is providing a certain service. That would be the next slide. For example, you're having a meeting or you're having a focus group and you have somebody that is providing the catering or they're providing transportation for these individuals. All they're doing is providing that service, nothing else. And trust me that sometimes people may get confused and they're trying to, when they're worried, they want to make sure like, okay, so the catering does not, and I'm like, no. It does not, because if they're doing that as part, okay, let's just make it clear. If they're doing it because you're paying them and you're like, we need a caterer, and you hire them to provide the service, it's very different than somebody that is a community member saying, hey, I can provide the food. But that's still, just because that person is providing that service alone does not mean that they are considered involved in that research. They're just providing a service. And it's the same thing as you renting a location, and all they're doing is provide you the location for you to have the opportunity to conduct any event related to the activity, to the research in that location. So that may be different than if you're doing it in the hospital, because there is certain liability that is involved there. But this is more about just renting a locale in the community just to meet with subjects, or maybe just to hold your community advisory board meeting, or just a meeting, to enroll or, to engage community members from the, members of the community. Sorry, I'm rambling here. So, of course, the next one that we need to consider is human subjects. And this is when I know that sometimes there's a challenge, like when do we know that somebody is a human subject or not? So in this case, you just have to pay attention that what is the role that that individual is serving for that particular activity. So they are participating in the study and the researchers are collecting the data in order to answer a question. So that is different than collaborating in other aspects, but like they are actively, like they probably sign a consent document, or there was a verbal process to enroll certain individuals, like if they were completing a survey online, things like that. But like their role is specifically to provide the data that researchers will need to answer a research question. So that is basically what the human subject, and I'm minimizing it, I'm just trying to simplify it here. You know, you can always go to the definition that we put at the beginning, and those, you know, make sure that when you look at the second part of that slide that is going to be available to you, that it talks about the investigator interact with a living individual based on this information. So that is more like 2 bullets, but they're very heavy and it has a lot of meaning. But basically the point is this individual is interacting with researchers or, you know, with the research team for the purpose of providing data to answer that research question. So that is generally, in a simplified manner, what a human subject would be when you're trying to identify whether they are involved, not involved, whether they're a human subject or they're like a community member engaged in other activities. So that, you know, just keep that in mind. And then examples of somebody that is a human subject, it will be individuals like, you know, like we have here, that they are diagnosed with hypertension and they join a study. In the study, they will be taking a drug, and that drug will be compared to other drug, to something that is already on the market. And the investigators will collect data from them, probably samples, blood samples, or other type of samples, so that they can compare whether that drug is as effective as the one that is already in the market. So the role of that individual there is to allow the researchers to have the answer to the question they're seeking to, you know, to address. So another example is if you are inviting, you're interested in learning about diabetes or management of diabetes in a particular community. It has been identified that there is a lot of challenges. There's a higher incidence in this particular community than in other groups. And, you know, community could be a location, community could be a group of people, community could be, you know, a place where the services are provided. So whatever that community is defined as, like whatever is that group that you want to evaluate. So there's a focus group and they identified, you know, they want to understand more about how diabetes is managed. So they invite these individuals and they ask them about their experiences with diabetes management. And that data, again, is going to help investigators to either create new questions, you know, for further research, or maybe the answer will help them develop a better management system for the particular group to help them handle diabetes. And I wanted to include this particular example here because sometimes I get the question that there is this community, I may shift between community participatory research, community-based participatory research, or community-engaged research. And the question is like, well, we're doing this focus group because we want to get an input from the community to know what is it that we need to ask as part of our research. How can we better address, how can we better design the protocol? And that is when you have to be, this is where it's important to look at what we use as a definition for human research. What is the information that you are collecting from them? What is the purpose? What is it that you're intending to do with that information? Because it is different if you have a community advisory board and you have researchers, you have members of the community and they're talking, you know, they're exchanging ideas and, you know, they're coming together and say, this is a good way to address things. Another one is you have members of the community coming to a group. You're going to be asking them questions about their experiences so you can better develop a program. Then you have to question yourself, am I asking certain information, like identifiable information pertinent about them? That may be research. So that is when you have to, like, those are the challenges trying to figure out what is it that I'm doing. And I always recommend, you know, you can give us a call. You can even just submit what we call an NHSR and say, here, we have this grant, we are trying to develop, we are not even yet into the phase of doing the study, but this is what we're doing. These are the activities that we're gonna do with the members of the community. Does this meet research? You know, just ask us, you know, and we will be able to help you. You can call me or you can just submit an application to NHSR. And, you know, because these are the times that line gets confusing. So, and I get this question a lot, but it depends on what is the information you're collecting and what is it that you intend to do with the information that you collected. Now, the other group, and the one that I think that you're most interested in to talk about, is the collaborating community member. And normally it's called a community engaged member, but really here I just chose to say collaborating because in terms of the IRB, engage may mean something else. And it can get confusing when you talk to us. It is okay if when you're talking to somebody else, you say community engaged member. Here, when you're talking to the IRB, when we say somebody's engaged, it means that they have to go through certain processes. They have to be listed in the application. You need to let us know about the activities that they're going to be involved with. And I know that that's the part that many get very nervous and confused because they don't know, like, what is it that I need to do? You know, do I really need to include these people? Do I really need to make them go through the training, CT training that we all have to go through? And yes, I know it's training because I have to take them myself. So anyway, so there are different levels of collaboration. And then, so I rather call it collaborating because depending on the activities that those individuals are doing, they may be considered engaged in research or they may not be considered engaged in research, but they're still valuable members of the research team. So when it comes to the role or the level of involvement, they're actively involved with the researchers and they provide a lot of impact, they collaborate with the researchers, and they also, their role when interacting, the relationship that they're having with the investigators is of a partner. In the other case, like with the non-collaborating, there was no relation. With the human subject, the relationship with the investigator was researcher. In this case, the relationship is a partner. They're partner, they're helping shape the research protocol that is going to be conducted. They provide a lot of input, especially information about the culture that needs to be addressed. And I promise myself not to talk too much about ethics because that's my favorite topic, but they're like, I can quickly bring the Havasupai tribe. Many of you may have heard it. And it was a situation where this researcher went to this tribe and, they agreed that she could obtain some information. If I'm not mistaken, it was for the purpose of research, for diabetes, to study diabetes. So she collected all these blood samples. She published her information. And as far as the tribe was concerned, their interaction with this investigator was done. However, because she had all these extra samples, she decided to continue doing other type of research with those samples without contacting the community or the tribe to obtain their permission. And this is the same concept as when researchers come to us and they say, we want to use this extra information that we collected for this study to use it for this different study. And we always say, did the consent document say that you could use that information for other studies? And it's all about the trust that Julie mentioned at the beginning. Is the ability for the community, the ability for the individuals to be able to trust the researchers. So what happened with the Havasupai tribe? Well, when the research published that there was a finding of like high alcoholism and other dysfunctional situations that there's no point to discuss here because otherwise I will spend the whole hour on it. But the point was that the tribe was very shocked because this investigator never requested permission from their tribe because it's their culture. You have to consult with the tribe. You have to ask their permission. And they still went ahead and used this information, and it destroyed the trust. There was no transparency because they felt that she went behind their back. Needless to say that new regulations now address how you can interact with tribes because now tribes have their own IRB. So people have to do their IRB, then they have to go to the tribe's IRB before they can even do research. Like it became a very complicated situation just because the community was not properly engaged in the entire process of what this researcher wanted to do. So that is one of the reasons why it's so valuable for us to have this community, like this increase in community engaged research is excellent, is very valuable, but it's also why it is so relevant to understand the roles of the members and to ensure that that trust is always maintained. So some examples of what collaborating community members are is, for example, like if there's, again, I don't know why I picked up diabetes, seriously, but they're trying to obtain information to develop an initiative for diabetes health. So the members, the community members that were engaged, they help researchers with organizing the workshop, create educational materials, and they were able to engage the community to attend and host different classes. So basically, the members were able to provide the researchers with what was culturally appropriate and valuable for that particular community by providing their input. So that's one example of the value and the difference between what community member is versus a human subject is. So because the data that the community member was providing was not necessarily about themselves, it could have been incidental that they disclose their own experiences, but it was more that the goal was to provide the investigators with the information that they needed to develop a more culturally appropriate and connect better with the community. That is very different than obtaining data from an individual in order to answer a research question. So another example is, when youth groups get involved with researchers to address mental health challenges among adolescents in a community. So basically, these youth group assisted in drafting surveys that were more attuned with the way that teenagers communicate, and it was more like it connected with them. That's like the same way that sometimes you hear the IRB saying your consent is too complex, your questionnaire is too complex, it's too confusing, you need to simplify. The same thing is like the benefit here was they engaged with a group of young people that helped them develop information that was more at a level that the community, the adolescents could understand. So that was the value of having these community members engage in the group. So, it makes the community feel heard, they feel connected, they feel that they were not being overlooked, which is one of the things that Julie was saying, that people were feeling underappreciated. When the subjects feel like, oh, I can connect with this, they feel like this is about me. They are really trying to work with me and my issues. So that's another value, and that's how you can also recognize the difference. Again, the youth were able to provide information that allowed the researchers to connect better with the human subjects. Different again than obtaining data to answer a question. And the last example that I promise I'll give you is, when they're doing like respiratory health and what is the effect of respiratory health on air pollution. And again, like people could provide input. Maybe they have community advisory boards that they can communicate, and people provide their ideas and their experiences in overall, not like this is about me. The researchers were not obtaining information about them, but it was more like a conversation as a group about these are the issues that we should explore. And the researchers were there. Okay, so what about we work this way? What about we design it this way? And there was a connection with the community that allowed, again, to make them feel heard and make them feel connected. And it was like, it made them feel that as responsible for the success of that research as the researchers themselves. So these are some of the examples that we can see about what are the difference. And that is, again, how we look at the role of the community member as part of a study, especially when you're like, are they subjects? Are they collaborators? Is again, how is that you're interacting with them? How is that you're collecting information from them? Is it to design something, or is it to obtain information to help design something? And again, at the worst, you can just call us, or you can submit an NHSR. You don't have to submit your entire application. You can submit a particular section of your application and say, I just want to know this part. Is this part research? And that's what you need to hear, and we'll be happy to help you out with that. And that's what I have to say for now. And I hope I didn't talk too loud because I get excited. But, any questions, let me know.
And I'm just resharing the slides to see if that helps with being able to move them. There we go. Don't know what happened there, but the slides will be available, after the presentation to everybody. So thank you, Jan. So I'll talk a little bit about community involvement in research and when is a community member actually considered to be engaged in research. So if we look here at this diagram, it's kind of very interesting. It actually is from an institutional review board manual that we utilize. And if you look at who has responsibility for conduct of research and shared ownership of data and joint decision-making, we want to make sure that all the efforts at engagement are aimed to ameliorate experiences and perceptions of what's being utilized, the data that's being utilized. And when we look here, we go from consultation to partnership. And it's extremely important that, as Jan has described and we talked about previously, that the activities go along this continuum. So there's many different things that can happen. So you've got surveys and focus groups, you've got community members and patients as members of the research team, which leads to community patient-driven research, a true partnership. So it can start off as consultation, a discussion, a dialogue, but then you've got a partnership, you've got community partners that are actually co-investigators, which is a whole different paradigm than, most people are used to in terms of research. So when we look at investigators who are engaged in research, this is important from the standpoint of what does an investigator need to do and what documentation is required in order to start the activities that are outlined in a grant. And as we all know, when a grant gets submitted, many different aims to a grant. You could have 4 or 5 different aims in a grant. And not all of those activities might be considered human subjects research. Now, that being said, one of the things that I know we have had to deal with in the past, and this is where it's extremely important for an investigator to reach out in advance of submitting anything to the IRB, is some activities on a grant might not be considered research, and you may not be considered engaged in research. But as we know, NIH and others, they fund research. So in many instances, they will not accept a non-human subjects research determination. They may not accept an exempt determination. But if we in the HRPO have a dialogue with the investigator ahead of time to say, what's the best approach, that can really help the investigator and the study team to save time. So there are certain circumstances where community collaborators may be considered investigators who are engaged in research, which means that their role must be overseen by an IRB, and certain human research protections training must be completed. And we all know about city training, but we're going to talk a little bit more about that at the end, because we're coming up with some different options for the types of city training that would be considered acceptable. So generally, investigators may include any individual involved in the design, conduct, or reporting of research. The types of activities that may qualify a collaborator to be an investigator engaged in research may include the following. So again, looking at a grant, looking at what people are actually doing, and the roles may differ between the different individuals listed on a study. So an individual is considered to be engaged if they're interacting or intervening with research subjects for the purposes of research. Again, that comes right from the definitions we talked about earlier. If an individual is consenting subjects for research participation, they are considered engaged in research. And if they are participating in the collection of, or they have access to identifiable data from research subjects, they are considered engaged in research. So an example of not being engaged in research would be someone who's handing out flyers in the research community about a research study. They're not considered engaged in research. Even someone who may be handing, a consent document to somebody to read, just to say, here's the consent. As long as they're not asking any questions, they're not involved in the informed consent process. So they would be considered not engaged. So the PI is always engaged in activity. So if they're actively involved in the design, conduct, or reporting of the research, they are responsible for ensuring compliance with ethical standards and regulatory requirements. Co-investigators and collaborators, individuals who, again, contribute to the design, conduct, and reporting, even if they are not directly employed by the institution. So there's many collaborators who are not UMB employees, or co-investigators who are not UMB employees. And then study coordinators and research staff, who are responsible for day-to-day operations, management, and implementation of the study, including recruitment, data collection, and participant follow-up. They are considered engaged in research. So who is not engaged in research? External service providers. Jan mentioned before some examples. Data safety monitoring boards are not engaged in research. That's why data safety monitoring board members are not listed on the Cicero application as study team members. Regulatory agencies are not engaged in the research. They have oversight responsibilities. And we as an institution have obligations to report to regulatory agencies when certain requirements or determinations are met. And then consultants, individuals who are providing expert advice or guidance to the research study. Community members, if they don't have direct involvement in study, design, conduct, or reporting of the study. So examples of community engagement. If study staff and collaborators interact with human subjects by drawing blood, administering drugs, collecting data via non-invasive procedures, a mouth swab. If you are manipulating the environment, controlling light, sound, temperature, or presenting sensory stimuli, or if you're interacting for research purposes, such as conducting consent or conducting interviews, focus groups, or even one-on-one interviews, that's when there is engagement and IRB oversight. So when individuals in a study are not actively involved in a human research activity, there's no interaction or intervention. You're using anonymous or de-identified data. So collecting information from a community in such a manner where the data is de-identified or anonymous. And this sometimes can be tricky. I mean, you can say we're collecting data in West Baltimore, but if you get too specific on where it's being collected, then a community or individuals can be identified. And then using publicly available information, public databases, accessing that type of information may not be human subjects research because the information is publicly available. It is available to others, not just the investigator. In terms of upcoming updates, these are areas where the HRPP, the Human Research Protection Program, is exploring options in order to make it easier and more accessible for individuals who would be required to take city training because they were engaged in research, but for whom city training in its current form, whether biomedical or social behavioral involves too much information that is not applicable to those who need to take the training. So here are some links right here that we are currently exploring as an institution. One is called certification, and the other is called Research Ethics for All. So in other words, we are exploring having these trainings available to those individuals who would be considered community collaborators, for whom this level of training is more appropriate than having them do 18 modules of city training. So please take a look at those and make yourself familiar. Again, we are exploring these options because they are much more appropriate for community collaborators in terms of having to take city training. The other thing we are exploring within the Cicero application is to have a designation when you're adding someone to a study. So right now we've got PI, co-PI, research team member. Having an additional member role that would say community member. So we could then, the PI could choose that role, and the IRB would know what level of city training would be required. So what we want to reinforce and take home today in terms of the presentation is the importance of distinguishing the roles, because it is very important to maintain transparency in who is involved in the study. We need to respect the autonomy of the community and the collaborators, all while upholding ethical standards in human research. And having additional types of training options available helps us as an anchor institution, and for those of you all who are conducting community-based research, to maintain transparency, respect autonomy, and to uphold ethical standards in research. We would now like to take any questions. Which I think Wanda is going to.
Hi there. Hi, Julie and Jen. I'm just looking at the questions that have accumulated. I wanted to just backtrack to Casey Jackson's question. She has one in the Q&A feature. She wants to know if you can speak to how the definition relates to protocol development in non-CBPR, community-based participatory research. A researcher may collaborate with colleagues to develop a protocol, and that action is preparatory to research, specific to protocol development, not widely applicable or generalizable. Our community collaborators seen differently?
It's basically like what we said earlier. First of all, anybody that is collaborating with the researcher, whether they're a community member or not, they should be seen as equal as part of the community-based participatory research. So it will be based not on whether they're a community representative, but what is the role and what is it that they're doing as part of the study. As Julie mentioned, sometimes community representatives will even be investigators. And so it all depends on what are the responsibilities as part of the study, the same way that it will be determined for any other individual that is a partner or colleague for that study. The other question that I think that it was, I'm treating this as split, is I think if the question is about when the data collected from, I think it comes to the example that I was giving regarding when sometimes you do a focus group in order to develop the questions for a study. I think it's always like something that the area belongs to say. It all depends what is the intent and the nature of what they want to do with those answers. If the answer is solely just to, to create the research design, they have no intention of doing anything else with it, it could be determined that the protocol or the activity is not human research. It may still be research, but it may not be human research. But another example could be, are they using the data to create or design the study, but they may also intend to use that data as part of answering the questions for that research. It may be that that activity may be considered human research. Even if something may not rise to the category, and this is where it gets tricky, and this is when I get more concerned about how to answer this question. Even if something may not rise to the definition of human research, or like Casey was suggesting, maybe it's not intended to be generalizable, it's still important to ensure that the privacy and confidentiality of these individuals is protected, just for ethical concerns, even if it's not for regulatory issues. And I'm not saying, oh, now you have to get a consent document or not. I'm just saying that regardless of whether the IRB determined that something is human research or not, we encourage the researchers to always treat every information shared by community members with respect their privacy, their confidentiality. One thing, if they want to share their information, that's fine, but always just take those things into consideration as part of building the trust with them. But it all depends on what is the intent of the data, how the data is going to be used. And that's why I was saying, look at the definition. Does it meet the definition of research? Does it meet the definition of human research, what you are doing? Then you need to reach out to the IRB and talk to them about, I think that this may or may not be, because like Casey example was providing is not generalizable. So that means that it didn't meet the criteria for research as it was stated on the slide. So that's what we need to consider.
There's a couple items in our chat, and it relates to our city training for our campus. I believe that there can be some modifications to that platform that would allow you to modify or adapt it to meet the needs of the community. I'm going to let Margaret talk, if that's okay with you folks. Margaret, would you mind? I've just allowed you to talk, so if you could share your thoughts on that, this would be great.
Sure, absolutely. So I'm Margaret Rankovich. I'm the Director of Content Education at City Program. And I just think sometimes we just think that City Program is one thing, one type of course, but it's completely up to your organization and the admin and your policies, what modules require, what grade books, and for what learners. So for example, like community researchers, you could potentially require like what you feel is the minimum for them to do, which could be like 2 or 3 modules, maybe consent and regulations and something else in SBE. Those kind of core modules for human subjects research are offered in both text and audiovisual formats to accommodate the different learning styles. But that's something really you need to contact your city admin at your organization and then align it with your policies and your training needs. But those things are customizable.
Yes, and we have taken that into consideration, and that's one of the things that we are certainly exploring. And the reason that we are still looking to what kind of training to make available to the community member is depending on what will be the role, what is it that they're going to be doing. The situation with City is that sometimes the reading level or the language that is used there may not fit most of the community members that may want to engage. And we just want to make it accessible for individuals that may have a need for a more lay language or a more simple, I don't know how to say this without sounding terrible, but it's just that sometimes like there may be individuals that may want to volunteer, and the level of information or the language that is used may be too challenging, and we don't want we want to be able to provide for everybody. Like one of the education programs that we mentioned, the Research for All, is one that was specifically designed for people with cognitive challenges, because they still wanted to be able to collaborate. They still wanted to be part of the research team and help. But the city was a little bit exhausting for them.
Okay,
I don't know
like,
how to
good
say
feedback.
that.
I'm sorry, I'm gonna mute myself. I've got another call to go to at 1, but thank you so much for the presentation. It's been really.
Yeah, and thank you for the recommendation. We definitely gonna include that as part of the options.
Sure, and feel free to
Thank you.
reach out to me personally and directly as well. Thank you.
I will. Thank you. There is a question about, I am working with a patient advocate in the consultant role in our research. We have a non-scientist colleague who will perfectly fit the role, and because she works in the same building, it will be more of a partnership, and we will love to work with her. However, we do not know how to pay her because she is an employee and patient advocacy is not part of her job. So basically, you're saying that there is somebody that would like to volunteer with your group.
I will just interject here. I am thinking that maybe this is about how do you pay for someone to be, as an advisor when they're already employed with the system. Julie and Jen, do you answer those type of questions, or Dr. Kleckner,
No.
maybe you answer that
I don't think
offline
so.
No.
if that works for you. I do know that we do have some administrative leadership in the ICTR that might be able to help guide you on that question outside of this seminar. So if you wouldn't mind just touching base with us with an email, that would be great. So do we have any other questions there's another one in here, Jan, from Dr. Agarwal about key informants who are helping the researcher familiarize with the community and identify potential recruitment sites. Will they be considered engaged or non-engaged individuals?
They can be considered part of the team, but based on that description, they will not be engaged, meaning that they will not have to like go through the training or anything. They're just helping them. They're basically not interacting with subjects or their identifications, identifiable information, so no. And remember, when I'm saying engaged here, we're talking about the regulatory requirement for engaged individuals. So you may say this individual is engaged as part of the study, but to say that they're engaged as per the IRB definition, no, they're not. They're just a collaborator.
I'm just checking to see if we have any other questions. If there's not any other questions, I would like to highlight that the ICTR does have funding opportunities for community engaged research. We have a community engaged research voucher program, and that program is really meant to provide you resources to help establish a partnership with the community to identify a research question, and then the next step would be to apply for a pilot grant or an extramural community engaged type research grant. So I'm going to put the link in here in the chat to our ICTR funding opportunities, and you'll see a description of both of those. One would be, again, the voucher that supports that activity, and then the actual pilot grant opportunities that we offer annually.
There's an additional question. is the software engineering retrieving identifiable information? Then they will have to complete the city training as required as per their type of study. So it depends on that will be that's an interesting question about right now they will require to complete the full module, but that is an interesting question, and I will definitely gonna make note of that to determine whether that will be depending on the role what they will be doing. If it's not study specific, you may have to complete both biomedical and social behavioral. It depends on the type of and I mean not the study protocol, but the type of study, like whether you're doing social behavioral, you're collaborating with social behavioral scientists or biomedical scientists. But I'm gonna make a note about that. Thank you for that question.
So I would like to thank Dr. Doherty and Jen Martinez. Wonderful seminar. It was very popular. We had 70 attendees, which we're very proud of. And if there are any remaining questions, then I'm sure they can be either directed to the ICTR,
Absolutely.
to the IRB. Thank you, and thank you, everyone.
Thank you.
Absolutely. Thank you for having us.
Most of all, thank you, Wanda.
Yes, thank you, Wanda.